watching PHTV4 Spotlight. Today's Spotlight is on National Heartworm Awareness Month. And we are at Palos Animal Hospital in Palos Heights on Harlem Avenue. And we're very fortunate. On my left, we've got Dr. Rachel Thomas. And on my right, Jen Fisher, who is a volunteer, a founder, and president of Traveling Tales Dog Rescue. Did I get all that right?
Yes, correct.
And, so heartworm, if you're a pet owner, this is a thing, and it can become a scary thing if it's not handled correctly or timely. And, there's a month dedicated to the importance of the awareness, to this issue. So I think first I'm going to turn to Dr. Rachel, and if you can tell us, what is heartworm? Why is it so important that pet owners be aware and address it?
Sure. So heartworm disease is caused by the parasite known as Dirofilaria immitis, which is colloquially known as a heartworm. This disease is caused by the worm. It affects the cardiovascular system of the dog, and so the heart, the lungs, and it can be potentially devastating and potentially fatal.
And, so that was pretty scary. Thank you for that. What about now? Is there a reason, seasonally, we should be aware of this or addressing it? Like here we are in April,
So absolutely. As the mosquito population starts coming out with the spring, we can see spikes in cases, but this can affect pets year-round, not just seasonally here. There are over 1 million pets in the U.S. who are affected by heartworm disease, and so we do want to try to have awareness of it during this month to bring attention to it, but we want to be aware of it year-round throughout the pet's life.
Okay, so part of the reason now is the transition out of winter, and people are getting outside with their pets, and the insects, and the things are showing up, I suppose. Maybe we'll get to that one in a second. I want to ask Jen, especially as somebody who deals with rescue dogs, I know you're a pet owner yourself, Dr. Rachel threw out the 1 million, pets with heartworm, and it's a huge number. What about you as a pet owner, in your experience with this, especially also with rescuing dogs?
Well, basically, our rescue, Traveling Tales Dog Rescue, we have had 6 cases in the last 6 months. And what's really surprising from our experience is that basically a lot of people are not aware what it is. They don't understand that it's actually transmitted by mosquitoes. They actually think that it's in the stool, some kind of an intestinal parasite. So it's becoming increasingly more, it's becoming more of a problem that people don't understand exactly what it is and how to prevent it.
Okay, and maybe and I think that's probably the key phrase that we want to look at. There is a way to prevent this thing. So I guess there's twofold. Maybe, Dr. Rich, you can talk about maybe the best cure, I guess it would be prevention. But what if you are that pet owner, no, it's too late, my dog and we'll talk about other pets can get this too, but you think your dog has heartworm. How would they know that, and what do they do at that point?
Sure, that's a great question. So heartworm disease is kind of insidious in that you don't always see specific signs. Sometimes they have a mild cough, sometimes they have mild exercise intolerance, so it used to be really easy for them to go up and down the stairs, and now they're getting a little bit winded. Sometimes in more severe cases, you can see them being lethargic, you can see them having side effects like they don't want to eat, they're experiencing weight loss. Sometimes the only clue that you get is unfortunate sudden death as far as it goes, or acute heart failure. The mosquito bites the dog, and it takes quite some time for them to develop and finish their life cycle as a heartworm. And so 6 to 8 months is generally how long it takes for them to start showing signs as it goes. But once the worm is there, it starts to cause irreversible damage. And the way that we test for this is with a simple blood test. And so if you brought me a dog and we did the blood test and the dog was positive, we would then go ahead and confirm it, try to stage the dog's heartworm disease, and then begin treating the dog. Treatment can take quite some time. Usually it takes about 6 months to treat the dog, and it is a very intentional process of how we do that, going through different treatments, different medications to kill the baby worms and the adult worms, and addressing the pain that's associated with this, because while treatment is life-saving, it can be difficult.
So it can be treated, but obviously I'm assuming the sooner the better. And so, Jen, I guess I want to ask you about this. As somebody who's seen 6 rescue dogs that have had it, how did you recognize it? And then I take it you're going through some of these procedures now with dogs.
Yeah, well, basically we found out because they were heartworm tested. So they had the blood test that came back positive. And then usually what happens is they're on doxycycline. It's an antibiotic for 30 days. And then they wait 30 days. And then they do an injection, which is a certain chemical, amiticide. Is it amiticide?
Melarsoline.
Okay. Yeah, and then after that, there's another 30 days that passes, and then they do 2 doses back to back. And I believe with the 3 injection method, there's like a 98% chance of curing the disease, correct?
Correct.
So that's what most vets prefer from our experience, and that's what we do. It's quite painful for the animals, not so much the doxycycline, but when they actually get the injections, they have to shave a little patch of hair on their back, and they inject this into the muscle, and it's quite painful.
It sounds like a very involved process. Listening as a pet owner, I'd say, yeah, maybe I don't want to go down that road at all. And so maybe we can talk about the prevention part. But it sounds like, number one, if you think your pet at all might have heartworm, you need to bring it in and get it tested. I mean, that would be number one, right? All right, now, how about, let's say, no. Maybe I had a pet that had heartworm and it's treated and we're clear and we're all healthy now, or I've got a pet and we had the blood test a year ago, we're all fine still and we're good. Is there a way to not go through that process that Jen just described?
Sure, there are various products on the market that are an easy way to help prevent them from developing heartworm disease. There are different kinds that are available, and the type depends on, or the way that it works depends on the medication that it is. So talking to your vet to decide what medication is going to be best for your pet is the best way to prevent it there. And I would recommend year-round prevention as well, and I would still recommend, even if they are on yearly preventative, to keep them tested every year still, because we can see sometimes that if they were non-compliant, so they missed a month or two, or if just because nothing is ever 100%, if the medication did not work for a particular reason, that we're catching it early and detecting it early so that way we can treat the dog and intervene earlier in the course of disease rather than later when there's more damage done.
Right, so the importance of, in effect, like the annual checkup, you get the blood work done. And all right, so the conversation has kind of been around dogs, right? And you know, I think there's a public perception that that's the one that gets it, but that's not actually the case. There are other pets that can get this. And Jen, I don't know if you've seen this or experienced this with other pets, and maybe you can speak to it, but Dr. Richard, you can give us first, like, what other animals can, like, what other pets might an owner have that could get heartworm?
Sure, the 2 most common are the cat and the ferret. They are also susceptible to heartworm disease, and it's also recommended that these animals be on a monthly prevention or a yearly preventative to try to prevent them from developing this. The hard part about cats and ferrets is that there is no approved safe treatment for it, and so preventing it is the best thing to do.
Wow, I didn't realize this. So there is a treatment for dogs, but not for the others. So one more reason to make sure you're on top of health checks for your, I guess, and immediately what popped in my head is like, well, I get it if I have a cat that's going outside, an inside cat. What if I have a cat that lives inside, or like a ferret? I mean, I'm assuming they're not leaving the house, but what if I have a cat, never leaves the house?
Sure, even if your animal stays indoors, mosquitoes don't respect the boundary of a door and they can still get into the house, and so it's still recommended that they be on yearly prevention.
Okay, so there's a way it can still happen, and we have to be mindful of that. Okay. Jen, anything else about your experience with your pets or the animals that you've rescued that, you know, we need to add to make sure that we're addressing every part of this?
Well, one thing I can say is that the pets that we have had that were treated, luckily, they've all done very well with the treatment, and they've gone on to live the rest of their lives heartworm-free, and they're happy.
Okay, so you're also talking about a quality of life, a healthy pet, and makes for a better, you know, pet in that owner's experience with that pet. And I guess then the last question, Dr. Rachel, like any other advice for pet owners out there? You know, you've talked about, yeah, we need to have the annual checkup, you know, and get the blood work done. Anything else pet owners should do to, you know, help avoid that experience?
Sure. If you have questions, talk to your local veterinarian. If you've tried a prevention and you are seeing side effects from it, it's not agreeing with your pet, or you just want to know more about it, talk with your veterinary professional about it. We might be able to change their protocol, try a different medication, talk about what your concerns are, and talk about why it's important and in a little bit more detail to address your individual concerns with it.
Okay. All right. Well, thank you. Folks, don't go online and look at the pictures because it'll be disturbing. Or look at the pictures online. You'll understand why you do not want your pet to get heartworm. And especially in the case of a cat or a ferret, there's another layer of risk involved in it. So, Dr. Rachel, thank you. Jen, thank you very much. Thank you for what you do with Traveling Tales Dog Rescue. Not just rescue, but also, you know, taking care of their health, too. And Heart Awareness, National Heartworm Awareness Month. Take care of your pets. I'm Dave Wurzlow, and you've been watching Spotlight on PHTV4. We've been talking with Dr. Rachel Thomas at the Palos Animal Hospital and Jen Fisher, founder, volunteer, and president of Traveling Tales Dog Rescue. Thank you for watching.